Our healthcare workers have borne the brunt of the COVID-19 pandemic. The country now preparing to enter the next phase of the pandemic with the rollout of the vaccine. To find out how healthcare workers are coping, we cross now to our reporter Linda Mnisi, who is at Medicross Meldene, which falls under Netcare. Linda, good morning. Great to see you on the show this morning. A big question, I suppose, for some of the doctors working at Medicross is that they also spend time, even though there are general practitioners at Meldene, they spend time, a lot of time in fact, at hospitals as well on the front lines of the pandemic.
Indeed, Michelle. I mean, I had a conversation with some of the healthcare workers from yesterday, and they spoke really about how they spend most of their time in hospitals, really detailing some of the horrors that they are seeing. And one of the latest frustration that has emerged is how there's been very little information around the vaccine and how it's exactly going to be administered. We've heard various complaints from fatigue to really, public information and, the public behavior, really. But to speak to us about some of those challenges, especially in the private sector, Michelle, we've heard a lot about what is happening in the public sector. We've seen some of those horrific visuals coming out of those hospitals, especially if you look at Tshwane. But how have the private sector how has it fared so far? I've got with me Dr. Donnie Fick. He is a GP. Thank you so much for your time, Doctor. I mean, we've seen a lot, like I say, around the public hospitals and how they're fair. People think that because there isn't a lot of people that have medical aid and have access to private healthcare, the situation could be perhaps different for healthcare workers in the private sector. How has things been?
Good morning, Linda. And yeah, it's nice to start the day in normal clothes for once and not in full PPE. Yes, I don't know. People think that private sector might have it easy. I do believe we have it slightly easier than our friends in the government sector in the rural parts of South Africa, but we're at full capacity as well. We are at maximum go as we can be. I mean, at this facility, at the one that I practice at the moment, in December and January, we had patients queuing outside the door. We didn't have enough time or enough space to see all of the suspected people that had respiratory tract symptoms that unfortunately were diagnosed with COVID a couple of days later. So it has been full blast for us as well.
And talk to me about some of the things that you experienced. I mean, we heard not so long ago from, at Charlotte Maxeke, nurses and doctors detailing how, sometimes patients can be very abusive towards them. What have you experienced as healthcare workers throughout this COVID pandemic?
I think, human beings are their mental state is as fatigued and as fragile, I think, as it's ever been. And with that comes frustration. So if patients have to wait, if you don't get back to them within a day of their results, they get angry on the phone. Everybody believes that their health situation is the most important right now. And I think a little bit more understanding that we are doing the best that we possibly can. We have not had any leave in December. We have worked, I think it's 10 months straight, so we as fatigued as anyone else, but we're still here and we're still giving the best that we possibly can. And I think that's where the motivation comes from. When I look at the team I work with here at Meldene or the team at Mill Park, as tired as my colleagues are, they're still motivated every day to do the best that they possibly can. So the public needs to understand that we are giving absolutely everything at the moment.
And I mean, I want you to tell me, really, you speak about the motivation. Tell me about that, but also, tell us about the vaccine. I mean, we're hearing that South Africa will get its first batch of vaccines come Monday. What is the infrastructure looking like? What are the kind of conversations you're having as healthcare practitioners in the private sector around the rollout of the vaccine? And what are some of your concerns?
Well, very excited that the vaccine's coming, and I think it's been a long time in the pipeline. So I know as healthcare workers, we're eagerly anticipating this, and I think it's important that they vaccinate the frontline workers first to strengthen up the healthcare system as well. But to the public, it's a mixed bag of emotions from the public. Lots of people are eagerly anticipating it and wanting to get the vaccine. Others are very skeptical about it. And obviously, on all social media platforms, there's a lot of misinformation, conspiracy theories around what the vaccine is going to be like. And trust us, people that are working with COVID patients every day, it's hard enough trying to help these patients deal with the virus. Dealing with false information and conspiracy theories doesn't help. And we can't spend more time like talking to patients about that. We need to be doing our job, and I think lots of misinformation is part of the problem at the moment.
All right, there you have it, Michelle. Dr. Donifik there talking to us about, some of the things that they're hearing around vaccines, saying that it's already difficult enough that they have to deal with the pandemic. Misinformation shouldn't really be something that they are worried about. We've constantly heard, even from pharmacists, saying that government should also be prioritizing, tightening the front line. That will also help boost public confidence, because they will know that healthcare workers are being spared. There are people that will assist them when they're sick and when they get to hospitals.
Yeah, absolutely. Thanks very much for that, Linda. Some important insights there from a doctor who is on the front lines of the pandemic as we continue with our special focus on healthcare workers today.